My name is Shyam Loganathan, and I'm here representing the Monsoon Journal, a South Asian English monthly newspaper. Also here, we are fortunate to have Mr. Dilip Kumar from a leading Tamil newspaper, monthly newspaper, Veedu. Also, Mr. Kannan and Prem from TamilOne TV, a 24-hour Rogers channel, which can be viewed on channel 868. And also Mr. Navanithan from Tamil Biz Connections, an online media which is connecting the Tamil business community. As you know, we have over 300,000 Tamil Canadians living in the GTA, with a number of them living in the Markham and Stouffville area. The Markham and Stouffville Hospital has been the primary healthcare resource for a number of years in this area. Initiatives the Markham Stouffville Hospital has undertaken, it is the duty of the media to bring awareness to these noble activities to the community.
My name is Vinisha Vijaykumar, and from July 9th to July 21st, 18 intrepid travelers decided to go to Mount Kilimanjaro in Tanzania, Africa, to climb Okay, so from July 9th to July 21st, 18 travelers went to Tanzania, Africa to climb Mount Kilimanjaro in Africa for the Climb to Conquer campaign to deal with the stigma of mental illness amongst children and adolescents. With us today, we are truly fortunate to have Mr. Alan Bell, the Director of Corporate Sponsorship and Special Events for Markham Stouffville Hospital, as well as registered nurse Margie Mackey. Thank you so much, Alan and Margie, for coming with us to speak with us today.
Thank you. Congratulations on completing this arduous journey with the goal of reaching more than $500,000. First off, we'd like to ask, have you reached your goal?
Thank you very much, and thank you again for visiting us today here at Markham Stouffville Hospital Foundation. No, we haven't reached our goal. We had a very large goal of $500,000, and as of today, we're sitting at about $452,000, and the campaign is open until the end of the calendar year.
Congratulations! And why did you decide to choose to support the mental? Why did you choose to support child and adolescent mental health issues?
Sure. When we were looking at what we could do to help the community, and also in terms of the strategic plan of Markham Stouffville Hospital Corporation, determining what it is that we focus on here, one of the areas where we excel in York Region is the care of child and adolescent people suffering from children and adolescents suffering from mental health issues. It has a huge stigma attached to it, and it affects 1 in 5 Canadians. So we felt it was very important to share the message and, of course, ensure that we can help this cause as much as we possibly could. Sorry.
So what was your inspiration for choosing to climb Mount Kilimanjaro?
For myself is that I've worked at this hospital much before it opened, and I've always, my career has always been dedicated to mental health nursing. And so when I heard about the climb, it was like, wow, this is for mental health, and a climb itself is huge, but a climb for a cause like child and adolescent mental health is even huger than climbing the mountain. And I just thought this is an opportunity that I would like to take, because it just goes along the lines of what I think is so important and always has been in terms of what I can give to others, but also now a chance for the community to be involved as well and see, because the fundraising piece is a new piece for me. I help care for people, but I don't raise money, and so that was a new avenue of trying to make it important, break the stigma, and the awareness of raising money also brings the awareness of mental illness and mental health and the importance and significance of it in this community. So it was an opportunity to kind of bring that message to people with the climb, and I think now I realize how large it was. I knew in my head it was, but I didn't really know what that meant, and it just seemed to get larger. And being that this is Mental Illness Awareness Week, it's you know, we're seeing it everywhere, and it's like I'm in awe because in all my years of mental health nursing, I've never had that experience of what I've been having this year. So a huge dedication from even all the climbers, but the inspiration was just the cause itself, and it always had been for me. It was never about a mountain, because the mountain just is, and that seems like too hard, right? But it was about the cause, and that seemed doable, that we could do this, and we could do this in this community, and it's amazing what we have done up until now. I'm still so impressed by where we've come in the sense of how people have given, and that's been huge.
So there must have been a lot of training involved in for this climb. When did you begin your training, and what kind of things did you need to do to prepare for such a climb like this?
We began as a group, all 18 of us, around 6. Some people started a little earlier, but I would say 5 to 6 months before we knew we were taking the trip in July. We got together as a group 3 times a week to begin with. We had weights and yoga training twice a week by Mary Caulfield of Body Mind Health Works, who dedicated a huge amount of her time to ensuring we were all in tip-top shape. And that was one of the reasons that you mentioned earlier that all of us did complete the climb and make it to the top, is because we were in good shape. We talked about the fact that only about 40% of the climbers every year that attempt to climb Kilimanjaro. So out of the 15,000 that tried last year, only 6,000 people made it. So because we were determined and because we were well prepared in terms of our physical and also mental training with the yoga piece of it as well, we were able to do that. So we got together twice a week, and then every Sunday morning we started treks for 2 to 3 hours, and eventually we were trekking at about 8 hours, because it's the endurance component that has to ensure that you're in good shape. Plus a lot of people were taking time to train on their own. So I think most people, it was at least 8 to 10 hours a week that they were dedicated just to...
What thoughts ran through your mind as you approached the summit of the 4th largest peak in the world?
Because I was doing this for mental health and mental illness and the awareness, for me that whole climb was about that. So I would think about what my patients would go through, and on a daily basis we would be challenged through our physical abilities, challenged through our sleep, challenged through eating food that just it tasted the same every day, and even though it was different, it was hard to drink the water because the water didn't taste the way we were used to water. So the eating, the sleeping, all those physical needs, and that's a huge challenge for people with mental illness. And I would be reminded of, wow, this is what my patients go through every day, and when they're ill and they're more acute. And you know, and the piece of feeling, at times, even though you're around people, at times it felt very lonely, and that feeling of loneliness was could be huge, because you're in your head a lot of the time, and when you have mental illness, a lot of the time you are in your head. You know, you're thinking about what you're going through. They're not good thoughts a lot of the time, or it's just everything seems like so challenging, or maybe the thoughts aren't even your own thoughts. There are other things going on in your head. So it makes it really hard, and I would think about those things. And for me, that's really what the process was all about, what someone goes through recovery when they're ill. And the climb was a great analogy of that, because, you know, it wasn't easy, and it was pretty hard. And I think with mental illness, it's pretty hard for people too, that the eating, the sleeping, the getting up, and you know, we would have to get up at a certain time every day, whether you liked it or not. Otherwise, you knew you'd be left behind. So that whole process of recovery, that people know they need to get up, but it's so hard to get up and to face that day sometimes. So so you always have to push yourself, and that piece of pushing. If you don't have any energy, which people typically don't when they're depressed or ill, is a hard thing to do. So, and you know, we were tired. I was exhausted. I wasn't sleeping. You know, the sleep isn't a whole other issue. So all those things just reminded me of what someone goes through when they're depressed, when they're ill, and not having my family, or I had the group, but you know, you didn't always want to burden the group with how you felt, and because you didn't want to bring people down, because you knew if you brought people down, that's not helpful, because you might stop. right? So that was the whole piece. And for me, I had spoken with a lot of people before I left about mental illness. So family members who had lost children to suicide, to people that have suffered depression. And I mean, I do that in my work every day, but I think what struck me the most was the suicide factor, that we have a lot of young kids that are taking their own lives. And it doesn't need to be that way, and we need to be doing more as a community, as a society, as a country, in order to be able to acknowledge, support, and validate, because stigma does prevent people from seeking help. And people feel really desperate, and we have to start validating their needs, validating what they're feeling, as opposed to discounting those things. So for me, the climb was all about that, and most of the time my head was there. And so that, it was like, when we got to the top, it was like, wow, you know, I think it was the spirit of people that I knew within the mental health system, the care providers, but also the people that have struggled and maybe aren't here today. So those were the people that I think took me up that mountain, and my own family. And so, you know, it's so hard. It was so emotional. And so it's really, I'm explaining it, I guess, in the best way that I can, but it's one of those things that, you know, it's almost like your whole life experience comes with you. And all the people you've met come with you. So often I would even think about people that I know and that have certain strengths, and I would use their strength to get me to that next hour or whatever that is. So getting to the top was, everybody was there with me, really. Everybody was there.
So there are undoubtedly many in our Tamil community who would like to help Markham Stouffville continue this, you know, this very noble cause of bringing awareness to mental issues in children and adolescents. How can our people, you know, help Markham Stouffville do this?
Thank you. Well, they can actually visit our website at www.climbtoconquer.mshf.on.ca. And I'm sure for those of you that live in the community and for those that don't, you're aware that Markham Stouffville Hospital is expanding. We're actually doubling in size, and you can see the building outside, how well advanced we are. And by the spring of 2013, we'll be moving into the new building, and it will have an entire new mental health facility. It's almost tripling in size, and that is due to need. So people can go online, they can support us that way. If they're familiar or friends with colleagues with one of the people that can contribute to the climb, they're welcome to sponsor them directly, or also there's just a direct sponsor notation there as well that they can follow and support the cause. But we are at about $450,000, and we'd like to make it by the end of this calendar year to our final goal of $500,000.
Mm-hmm.
Well, well, thank you, Alan and Margie, for taking the time to speak with us. It's been great. You guys have given us so much to talk about, and we hope the Tamil community will definitely support this cause.
Thank you very much.
Thank you.
Thank you. Thank you very much.
Oh, thank you.